Okay, good morning, everyone. Welcome to Listen to Your Gut, what your symptoms say about your gut health. This webinar is for awareness and education purposes only. A one-on-one consultation with a licensed physician is recommended for a personalized health management. Mhm. In the recent years, there is growing awareness on the health benefits of maintaining a healthy and a well-balanced gut. Several products have been made available in the market to aid us with varying digestive symptoms. Today, our guest speaker will help us know more about how to stay attuned to your gut feeling by knowing what symptoms to watch out for, what the risk factors are, and what we can do to better take care of your gut. Our guest speaker today is a resident consultant at BioBalance. She is a practitioner of functional medicine under the Institute of Functional Medicine, which allows her to discover the root causes of health concerns by doing a comprehensive lifestyle assessment and identifying areas that need to be addressed in order to promote health and wellness. She is a certified trainer in HeartMath, well, she teaches resilience building, energy management, and stress transformation. It is an honor to present to you Dr. Angelica Lorenzo.
Hi, good morning, everyone. Can you hear me? So, okay, let's get started. These are our learning objectives for today. So it's not the outline, it's going to be interspersed through the discussion and marami tayong i-discuss. So let's get right to it. But let me stop my video so you're not distracted by my face. Okay, so what comes to your mind when you first think of the digestive tract or shortcut, the gut? Diba it's these two functions? But between eating and then pooping, there's a whole lot more going on, as in marami pang nangyayari within the 20 to 25 feet of our guts. These puzzle pieces give you a quick rundown of those other functions. So I'm sure narinig nyo na yung phrase na, you are what you eat. But that's not accurate. Ang totoo, you are what you eat, digest, and absorb. Simply put, if you don't digest the food, you can't absorb the nutrients. Now, most people know that probiotics, usong-uso na sila ngayon, are good for us. But the truth is, they're not just good for us. Our health actually depends on the bacteria in our gut. And our immune system doesn't just defend us from germs. It actually works in tandem with those so-called germs to modulate our immunity and inflammation. And then our gut has a brain of its own, which communicates with the brain in our heads. So let's dive deeper. Let's start with the intestinal barrier and permeability. So they estimate if you take the inner lining of our gut and then you spread it out flat, parang pag nilatag mo siya, ang tansya nila kasing laki siya ng tennis court. So kung nakanood na kayo ng tennis, that's pretty big. And it's only one layer of cells. So mas makapal pa yung skin natin, yung balat natin, than the lining of our gut. There's one layer of cells between whatever you're eating and your blood supply. So once something gets into your bloodstream, it can now go wherever in your body. So, because it's very wide, that lining of our gut, and very thin, they estimate na 70 to 80% of our immune system is in the gut. So let's take at that layer a bit more closely. Starting with the lamina propria. Hindi, joke lang. Hindi tayo ganun ka-serious ngayon. But I do want to point out something here. This red arrow shows you this blue layer. That's a layer of mucus. Okay, and that protects the cells. So I just wanted to point that out, but let's use a analogy to help me explain this. So if you think of your body as a house, or in this case, a mansion with big gardens. The lining of our gut is this fence. Okay? And if you notice, I'm kung nakita nyo yung, it's very faint, that fence. But, and just like the gut, you have one layer of cells. And if you notice, there are plants outside of that fence, the shrubbery. That's like the mucus layer. It prevents you from coming right up to the fence very easily. So it's an additional barrier. And then this canine unit, your immune system is kind of like this canine unit. It's patrolling the grounds. It's making sure walang unwanted invaders or guests. And then the rest of your organs and your cells are these house staff. So this staff is in charge of preparing food, housekeeping, cleaning, repair, etc. So ideally, no one enters your compound without your permission. Meron lang designated points of entry or gates. And pag sa gate pumasok yung bisita, alam nung canine unit na imbitado mo yon, and the dogs, they stay calm. So there is peace and order in your grounds, in your compound. And the house staff can go about doing their jobs nang walang interruptions or obstacles. So as with anything, there is always wear and tear. Diba? So maintenance has to be done on a regular basis. So that's easy for us to think of, let's say, with our houses or our cars, diba? We maintain them. But we forget that that applies to our body as well. And there is a delicate balance between the normal wear and tear, okay, which happens, every 3 to 5 days, di ba isang layer lang ng cells yan. So every 3 to 5 days, kailangan may new cells to replace that layer. Unlike our skin, may mga girls dito, di ba, we exfoliate our skin to bring new cells to the surface. Sa gut, isang layer lang yon. So every 3 to 5 days, there has to be new cells. But in addition to the normal wear and tear, there are a lot of other things that can cause more damage. And as soon as the slide changes, you will see a list of the most common ones. So stress in all its forms, physical stress, mental stress, emotional stress, whether it's late nights because you have a lot of work, or late nights because you have been binge watching the latest K-drama on Netflix, which, you know, is common for everyone now since this whole lockdown. Um, but stress in all its different forms can increase your cortisol levels, and it keeps you in something called a sympathetic dominant state. Another very common damage trigger is our medications. So the NSAIDs, or the pain relievers, antibiotics, antacids, and then there are toxins in food, in the environment, from an imbalance of bacteria in the gut. So if you experience or use or are exposed to any of these, and in reality, lahat naman tayo at one time or another exposed dyan, then these are all risk factors for developing gut health issues. And then that delicate balance of wear and tear and damage has to be repaired, right? So we need to talk about your capacity for repair. If your body is able to repair the damage, then okay lang, walang problema. But if that capacity is decreased, then that's a problem, right? To repair something, you need materials. So kung kulang yung materials, hindi mo siya maaayos. Kung kulang yung nutrients, protein, minerals, etc., na nakukuha ng katawan natin, then hindi rin niya ma-repair yung gut lining. And this decrease in nutrients can be due to maybe a not so healthy diet of processed foods or highly refined junk foods. Or even if you're trying to eat healthy foods, baka hindi mo naman na-digest ng maayos. And so, hindi mo rin na-absorb yung nutrients. 'Di ba? Sabi natin kanina, you are what you eat, digest, and absorb. So let's go behind the scenes to talk about digestion. Ito yung cast ng digestive system natin. And you can think of each organ as an instrument. And your vagus nerve, which really deserves a webinar to itself. The vagus nerve is the conductor. So if your vagus nerve is functioning well, then the orchestra of your gut plays harmoniously. But if your nerve is not functioning well, then the orchestra can become out of sync and noisy. So ito pa yung another risk factor for developing gut issues if you have a dysfunctional vagus nerve. And many things can interfere with your vagus nerve function. For example, and this again, very common in a lot of us, a poor breathing pattern or poor posture, like a forward head posture, or getting stuck in stress or survival mode, or eating too fast, right? So all of those can cause dysfunctions in the vagus nerve. And yung eating too fast, so isipin nyo ngayon, if you eat fast or slow, I'm pretty sure majority ng tao, they eat very fast. And here's what we miss when we eat very fast. So ito yung processes. Kanina yung organs of the gut, of the digestive tract. Ngayon ito yung processes. So anything that interferes with any of these steps can also cause gut issues. So common symptoms of maldigestion, the obvious ones, bloating, gassiness, problems with pooping, so either diarrhea or constipation, or some people say they have sensitive stomachs, mabilis masiraan ng tiyan, right? But basically, there is something wrong with the processing of the food stuff. And for a lot of people, the top two problems they have in this process is number one, inadequate chewing. Maraming tao mabilis kumain or nasanay na nagmamadali kapag kumakain. So hindi talaga nila nangunguya ng maayos yung food. Or for some, it's because naman they have problems with their teeth, like pangit yung fit ng pustiso. And in the elderly, this is common. Or with their jaw. Sometimes some people have lockjaw, sumasakit yung panga nila. But for whatever the reason, inadequate chewing is the top one digestive problem people have. People forget that digestion begins in the mouth. Our teeth are there for a reason, not for a close-up smile, but to break down our food. Now, the second top problem is incomplete chemical digestion, right? So, if you drink a lot of water while you're eating, 'di ba? Yung ibang tao umiinom ng tubig kasi panulak nila 'yon. Kasi nga hindi nila nanguya ng maayos yung food. Or yung ibang tao, they immediately after a meal they'll drink 1 or 2 glasses of water. And what can happen is this dilutes your stomach acid, making that acid weaker. In other people, this is also very common. The low stomach acidity is due to using antacids or acid blockers like PPIs for hyperacidity. And so let's focus on hyperacidity for a bit because that's such a common complaint, right? Yung hyperacidity. The stomach makes acid for a reason. We need acid to digest protein and absorb minerals and nutrients. So the stuff that our body is made of and needs to function. So yung not so obvious symptoms of maldigestion and malabsorption, which are gut issues, are due to the eventual nutrient depletion that happens when you're not absorbing because you're not digesting the food. So if you can read in the picture, right, it says here if you have poor absorption of vitamins and minerals, you can have diminished brain function, that's the neurological function. Your immune system can get impaired. You have weaker bones, so osteoporosis. Diba? When yung osteoporosis, you do a bone mineral density test. So kung konti yung mababa yung bone mineral density, that means you're not getting minerals, not just calcium. Calcium is one of the big ones, but all the minerals. Right, and then poor absorption of proteins. You can have hair loss, muscle weakness, you have poor wound healing, and a lot of other things. So I want to go back to the mineral deficiency because one of the also common manifestations of this na hindi natin naiisip is having brittle teeth or teeth na mabilis magka-cavity or magka-tooth decay. Kasi nga, our teeth are also made of minerals, and if you're not absorbing your minerals, then you have weaker teeth. Muscle cramps are another common complaint na we don't relate to the gut. But that's also because maybe you're lacking some magnesium, so laging nagka-cramps yung muscles. Okay, a lot of the other chronic conditions na we tend to expect as we get older, like yung mga so-called sakit ng matatanda, can actually be due to malnutrition. Kasi over the years, naiipon pa unti-unti yung mga deficiencies. So I just want to emphasize, stomach acid, very important. And so bringing back to that mucus layer is there to protect the stomach from the acid that it makes. Okay? So minsan, pag hyperacidity yung problema, hindi naman yung acid yung issue. Baka nga minsan kulang pa yung acid eh. Pero yung mucus lining, kulang din. And so, if that mucus lining is decreased, walang protection yung stomach from the acid. And then you get those symptoms na nangangasim, sinisikmura, and then we take antacids for that, which then decrease your digestion, bringing us back to our analogy and that decreased repair capacity for your fence. And I don't know if you heard the dogs barking in the background. And here they are in our slides. So as that barrier or fence is compromised, pag butas-butas na yung bakuran, makakapasok na sa gardens mo yung mga hindi mo inimbita, right? Once that happens, your immune system kicks into action to defend you from invaders. But the more gaps you have in that fence, the more invaders are able to get in. And then the more your guard dogs will be barking and chasing them all over the place. So this is inflammation, the response of our immune system to defend us from invaders and to repair injury is inflammation. So to be clear, inflammation is not bad in itself. It's a normal and necessary response. Pero kung tuloy-tuloy yung inflammation, if it becomes chronic and continuous, then problems start to crop up. And inflammation can manifest in different ways in different people. So you hear a lot of issues that end with itis. So anything that ends with itis is an inflammation. So dermatitis is inflammation of the skin. You have eczema, rashes, acne. Arthritis is joint inflammation, right? So all of the different aches and pains can be manifestations of gut issues. Too much inflammation. Diba? The most common pain relievers, the ones that are available over the counter, they are anti-inflammatories. Okay. Also, another manifestation that's related to the gut and inflammation is, you know yung feeling pag may trangkaso or flu or may matinding ubot-sipon ka? That kind of low energy, you want to stay in bed, tamad feeling. That's because of inflammation. Like your body's fighting off an infection, so there's inflammation. But you can have that same feeling even if the inflammation is not because of an infection, but because of something else, like a leaky gut. So baka yung feeling na tamad-tamad ka, hindi ka naman talaga tamad. Merong inflammation pala going on. Now, in some other cases, yung constant na inflammation na yun can cause dysregulation of the immune system. And this can result in autoimmune conditions, which the drugs of choice to treat that are called immunosuppressants. So again, you're trying to decrease inflammation. So yung chronic inflammation underlies many of the chronic conditions na very prevalent today. So again, yung mga sakit that we tend to associate with getting older. And I think this picture speaks for itself, right? So this can all be manifestations of gut problems. And the link is through that chronic inflammation. Right? So you might think, really, eye disorder, my eyes, what's the relation with the gut? And there it is. It can be because of inflammation. And here's another way to put it. If we put it like in a web, okay. Um, has the okay. I'll wait for you. Okay, there we go. So again, inflammation is in the middle. It links all of these different problems. Now, we don't associate with gut issues. So, for example, with the brain fog, you have decreased mental capacity, or you always feel groggy, or you can't concentrate. Or in kids, this is very obvious in hyperactivity, even mood issues, let's say anxiety or depression. Um, Chronic condition. So I just want to emphasize chronic inflammation equals chronic diseases. And one of the most common causes of chronic inflammation is inflammation in coming from the gut. Okay. Now we've talked about the inside of your house and your gardens and your fence. Now what's beyond that fence? What does your neighborhood look like? Right? Sinong kapitbahay mo? So this these images are from Google Maps. I just want to it's the same scale, 50 meters yung scale. But you can see the difference in the density, diba? So your neighborhood, going back to that analogy, is composed of two things. The microbes in your gut, and by microbes that includes bacteria, fungi or yeast, parasites. So the microbes in your gut, and then the types of food you're eating. And may affect yung mga kapitbahay mo sa fence or sa bakuran mo, and also may affect sila sa status quo inside your compound. So they can contribute to the peacefulness and calm in your body, or they can be a source of additional damage triggers. So, are you eating plant foods that are nutrient dense? Real, whole, fresh foods. These feed the bacteria or the microbes that are helpful and beneficial to our health, right? They foster a neighborhood that is peaceful and orderly. Or is your diet composed of more processed, refined, nutrient poor foods, which feed the bacteria and the yeast that can be harmful to us? And they can make that population of harmful bacteria, they can make it grow and increase. So, kamusta yung neighborhood? And let's concentrate a bit more on that gut microbiome, or the microbes we have in our gut. And in research now, it's being called our invisible organ, because they're finding out that the bacteria in our gut, they don't just live there. They are very, very productive. They help, let's say, with producing some of the vitamins, so B vitamins, vitamin K. Like I mentioned kanina, they work in tandem with our immune system. They actually have a role in developing the immune system. They help us digest food. They can actually also act like para rin silang they're another barrier, they're another layer of protection against the bad bacteria. They can crowd out the bad bacteria. And so having a healthy and balanced neighborhood is very important. And but when you hear of germs, it's always germs, ay bad, let's use alcohol and let's wash our hands and let's kill them off. But actually, there are more germs, in quotation marks, there are more germs that are actually our allies. And here's an example of the functions of probiotics, right? So if you see here, what do we, they even have a role in normalizing cholesterol levels, right? So maybe yung mataas na cholesterol levels mo, hindi lang cholesterol, yung mga statin ang kailangan. Baka kailangan palang i-rebalance yung bacteria in your gut. Or itong intestinal motility, yung constipation mo na inom ng laxative, ang kailangan pala is i-rebalance yung iyong um, gut bacteria. So, when that gut bacteria becomes imbalanced, that is called gut dysbiosis. Okay. And I want to point out again the risk factors. So see kung meron kayo nito, alcohol, smoking, kamusta yung diet. We mentioned that earlier. Antibiotic use, if you're always constantly using antibiotics because you're always sick. So it might be you're always sick because you already have an imbalance of bacteria in the gut. And then taking the antibiotics aggravates things, right? Or maybe because you use antibiotics a lot, kaya nagka-dysbiosis. So chicken and egg, you don't know which came first. But later we're coming on to that anyway. Yung what can we do to have a healthy gut? So let's just do a quick review of our learning objectives. Um, and we've discussed by discussing yung function ng gut, we covered ano yung pwedeng maging manifestations or symptoms ng gut imbalance. And ano yung risk factors for getting gut-related problems, right? So I hope the analogy helped to make it clearer in your mind. And then let's go on to ano yung simple lifestyle interventions for a healthy gut, and how do we rationally use supplements for gut health. So in functional medicine, we have something called a 5R gut repair protocol. Okay. And you can see it in the picture. So remove, replace, re-inoculate, repair, rebalance. Remove is primarily you want to remove inflammation triggers, whether that's let's say stuff toxins in food, like in the junk foods or in processed foods, or you want to remove, for example, there is an overgrowth of the bacteria, of the bad bacteria or bad yeast in your gut. You want to remove that because that it triggers inflammations. Replace, you want to replace the missing nutrients, yung mga na-deplete na over the years. Or you might need to replace digestive enzymes. Remember, baka kailangan mong i-support yung stomach acid or maybe bile. For some people who have had yung tinanggal ng gallbladder nila because maybe they had gallstones and it had to be removed, maybe they need to support their bile. Re-inoculate means to re-inoculate with the good bugs. So that can be through food, again, eating fresh, whole plant foods. That can be through fermented foods like, let's say, burong manga or kimchi or miso. And then you can also use probiotics and prebiotics in supplement form, right? And then number 4 is repair. We want to repair that fence. And remember, I want to emphasize, this is an ongoing thing. Maintenance yan. Diba? Sanay tayo mag-maintenance medication. Diba? But really, if we paid attention to maintaining our body, especially our gut and nutrition, then hindi na natin kailangan ng maintenance na gamot. And the last one is rebalance. And the number one thing here is learning how to handle stress, because stress is one of the um, most influential damage triggers to our gut. So, but also you need to pay attention to sleeping patterns and to other lifestyle factors which affect the gut. So, and basically everything affects the gut. So, number one, in the list of what do we do to make our gut healthier, eat more plants. Just eat more plants. Whether it's, and you want to get all of the different colors of the rainbow when you eat more plants. I won't dwell on this too much because I think this is more or less well known naman na. And the next is, okay, so we're used to thinking about what not to eat. Lagi tayong concerned sa, ay, anong bawal? Bawal ba yan? Bawal sa akin yan kasi tataas cholesterol ko. Or, and then, we also are aware of anong dapat kainin, what to eat, right? And like I said, eat more plants, eat more unprocessed, fresh, whole foods. But the third part of the puzzle, which people forget about, is how we eat. And how we eat matters just as much as what we're eating. So how to eat mindfully. Because this affects the way we digest. And remember, you are what you eat, digest, and absorb. So that savor the taste is in a red box because I want to emphasize that. Na yung taste, the taste is information that our taste buds send to the brain and the rest of the gut. Diba? For example, kung parang di nyo maintindihan kung ano ba't siya information. Pag nakakain ka ng panis, di ba niluluwa mo siya agad? And paano mo nalaman na panis siya? Dahil dun sa taste. So the taste is information. So for example, when we eat oily foods, our tongue will detect the fat and send messages to our brain and the gut to prepare to digest fat. So savor your food. Do deep breathing before and after meals so that you shift from a stressed fight or flight response state to the relaxed rest and digest state. Actually, if you look at all of the other steps here, and I'll let you read through it. All of these are basically helping you to shift to the rest and digest state. So your body is ready to actually digest the food and then absorb the nutrients. So you want to create an ambiance that facilitates parang relaxed eating. And so that includes putting your phone down and your gadget down so that you're paying attention to the food. Okay. The other thing that comes with mindful eating is you want to support your stomach acid and your other digestive enzymes. So limit water intake with meals. Again, para hindi mo nadadilute, hindi natutubigan yung stomach acid. Um, and the other thing is you want to make sure that you're drinking adequate water pero away from meals. So for example, depending on your weight, let's just say on average, a lot of us will need at least minimum 2 liters of water per day. But you want to be drinking that away from food. But it's still supporting digestion kasi our digestive enzymes are liquids. So kung dehydrated ka, edi kulang rin yung enzymes na magagawa ng gut mo. So hydration still plays a very big role. Another thing is you want to use medicines cautiously when needed. Okay, so for example, acid blockers, yung mga ang dulo ng meds na to, prazoles, omeprazole, pantoprazole, um, be careful, use them if it's needed, but try not to use them very often or for very long because they will stop your stomach from making acid. And remember, we already discussed how I put a spotlight on stomach acid na important siya. Hindi, pag nawala siya, the rest of the steps in digestion are affected. Okay. Also, again, with antibiotics. So this is very common. I get this often with patients na may ubot sipon, they'll want antibiotics. But the most common cause naman of ubot sipon are viruses, which the antibiotics do not have any effect on the viruses. So, they're taking it unnecessarily. And then also pain relievers. The pain relievers, the anti-inflammatories, the way they affect the gut is they lessen yung production ng mucus layer. So you lose that additional barrier or additional protection. And that's how they can actually cause ulcers in the stomach, right? Which will make you have to take acid blocker. So you see how these things can kind of spiral out of control and get you stuck into a vicious cycle that makes it hard for you to repair your gut. So I wanted to emphasize yung eating plant foods, eating mindfully, supporting your stomach acid, and then using medications rationally. And then I made this table. So it's easy. It's easier for you to see ano yung lifestyle interventions or ano yung habits, behavioral habits that will support each of the different functions of the gut. At the same time, I also put in that 5R protocol, saan sila, ano yung role nila. So for example, if you want to support digestion and absorption, and that's going to be replaced because if you're nutrient depleted and you want to replace your nutrients, then you need to make sure you're digesting your food and absorbing the nutrients, right? So chew your food well. I cannot emphasize this enough. Chew your food well, chew your food well, chew your food well. Please avoid and limit your water intake during and immediately after meals. Mga give it a 30-minute interval from your last subo to when you drink water. So allow your stomach acid to just dissolve that food for mga 30 minutes. Stay hydrated away from meals. Avoid antacids or acid blockers, and then drink sa labat. If for I get a lot of patients who ask, Doc, I have to take medicines or I'm taking some supplements. How do I drink them with my meals if I'm not allowed to drink water? Salabat is a good option because ginger, so you can do yung fresh ginger luya na pinakuluan, or you can do the instant na powdered salabat. But salabat ginger helps to stimulate digestion. And especially for those who have had their gallbladders removed, salabat helps to stimulate yung release ng bile. Okay, so I want to just point out, some people think na pag tinanggal na yung gallbladder nila, wala na silang bile. Actually, the liver makes bile, but the gallbladder stores it and concentrates it. So pag tinanggal yung gallbladder mo, you're still making bile, pero you don't have storage for it and it's not concentrated. So the salabat can help. Okay? Another option you have is kung merong sabaw yung ulam nyo, for example, tinola, pwede naman yung sabaw yung ipang-inom nyo nung gamot or nung supplements na kailangan nyo. It doesn't have to be water. I don't know why people tend to assume it has to be with water. Okay? So anything liquid that will help you swallow it is good. If we're looking at the gut barrier, and this is repair, we need to keep this repaired. So these two things, avoid alcohol. Alcohol damages that barrier. The pain relievers damage that barrier. And I didn't put here na yung like eating junk foods and processed foods. Immune modulation, so rebalancing, taking slow, deep breaths, helping you to shift into a relaxed state to digest better. Avoid smoking because smoking increases inflammation. So it makes your immune system more imbalanced. And then for the gut microbiome or re-inoculate, again, eat more plant foods, include fermented foods. It's super easy to ferment, to make your own fermented foods. As in, Google it, it's super easy and it tastes very good. And then avoid processed foods and refined carbs because they will feed more of the bad bacteria. Use antibiotics rationally, right? So these are the different lifestyle or behavioral habits. The next table will show naman how do we use supplements, like rational use of supplements. Because like when, as Pat said earlier in the introduction, ang dami ng products on the market. So again, digestion and absorption sa labat, which a lot of people think supplements need to be in pill form, right? So digestive bitters, by the name, these are liquids that are very bitter and they make you, di ba pag may nakain kang mapait, naglalaway ka? So digestive bitters stimulate secretion of digestive enzymes. Betaine with pepsin. Betaine hydrochloride supports stomach acid. It actually provides you with hydrochloric acid. And then pepsin is another protein digesting enzyme. And these two work together. They're like Batman and Robin. Tag team sila. They work better together. And then there are other digestive enzymes, so to support your pancreatic enzymes or your bile. So marami yan. For gut barrier and repair, there's all of these. L-glutamine is an amino acid, which is important for the cells in the lining of the gut. Zinc carnosine. Then I have to emphasize that kasi maraming forms of zinc, and zinc carnosine. In Japan, actually, they've been using this for over 20 years to help heal ulcers and other issues with the mucous lining of the gut. Amino acids or even whey protein, just to, if you need to supplement your diet with more amino acids. Remember, our body is made up of amino acids. Diba? That's why the bodybuilders will drink whey protein, when they work out to build muscles, but they also, um, it's not just muscles that they rebuild. They can also help rebuild the lining of your gut, your fence. Aloe vera and DGL, and oh, I forgot to put my favorite, okra, and then aloe vera and DGL support the mucus lining of the gut, that extra barrier that protects the cells. So immune modulation, things to kind of anti-inflammatories that are natural, that don't have side effects. Turmeric, and you can either have this in curry or turmeric tea or even in supplement form. And acetylcysteine, which is helps you produce glutathione, um, which is not just a pampaputi. That's how we all know it in the Philippines, pampaputi. But glutathione is actually one of the master antioxidants, and acetylcysteine. Um, when you take that, it helps your body produce the uh, glutathione. So L-glutamine, zinc, carnosine. What else? For the gut microbiome, probiotics, or there are different kinds of probiotics. There's lactobacilli. So someone asked in the chat, lactobacilli like Yakult. Yes, so Yakult has lactobacilli shirota strain. 'Di ba? Bata pa lang tayo, alam na natin 'yon. But there are many other strains of lactobacilli. And they in the research is coming up with the different functions that they have. Some of these functions are specific to the strain. And then there's bifidobacteria. So a lot of the probiotic products out there usually will have a mix of this, lactobacilli, bifidobacteria. And it's best if you take a product that has multiple strains. And then there are also something called spore-based or soil-based um, probiotics. These are the bacillus strains. And one, parang they all have the roles. Hindi siya yung one is better than the other. So it's best if you get all of them. And then there are prebiotics, which are basically non-digestible starches. So hindi natin kayang i-digest, but they feed the bacteria. And you can get this from food, but you can also get this in, supplement form where it's been standardized, and you can give these easily to kids because they're usually tasteless. You can just mix it in the food. And then berberine. The- Someone asked what is DGL. It's sorry, I have a hard time pronouncing the whole. It's like deglycerinated licorice. But it's a form of licorice na tinanggal yung glycyrrhizin. Because the glycyrrhizin, I'm sorry, I can't pronounce it, can cause hypertension. So they've taken out that component. And then it's very good for the gut. Okay. And I think that is my last slide. Um, and we have time for some questions which I can see are coming up. Let me just check.
Okay. Yes, Dr. Eka, thank you so much for that very insightful session. Pati ako, ang dami ko din natutunan. So I hope our viewers were able to take notes of the very practical tips that they can practice to improve their gut. So yes, we have some questions from our viewers. So one viewer asked, sabi niya, I'd like to improve my ability to digest fats. I've noted that in a stool exam, undigested fats were detected in my stool samples. I also have difficulty gaining weight. Is there a pre or probiotic you can recommend or an enzyme supplement?
Okay, so we need bile to digest fats. And if you're seeing like undigested fats in your stool sample, or you can actually check this for the other viewers, just look at your poops. After you poop, don't flush. Look at your poops. It can tell you a lot. If your stool tends to float a lot, it's like it's always floating, then it might be a sign that your stool has a lot of fat. You know how oil floats on top of water. And so the things that you can do to support your digestion of fat is Like I said, salabat stimulates bile release, but you can also use enzyme supplements that contain ox bile, or those look for in the label, look for lipase. Lipase helps to digest lipids, so fats. And then I think, let me just read through the question again, Pat. She was also asking about pre or probiotic.
Yes, Doc.
So, like I said, in general, if you need a probiotic that has multiple strains, and then prebiotics, if you're eating a lot of plant foods and you're getting fiber in your diet consistently, then you don't really need a prebiotic supplement. But it is for example, for kids who sometimes, they're picky eaters, or they're going through phases where they only eat one kind of, like carrots lang and nothing else, or you can use, there are a lot of prebiotic supplements. I would prefer the ones that are a combination of several different um, fibers. Kasi mayroong mga soluble fibers, may insoluble fibers. So you want to get, so an example would be psyllium. Psyllium is actually, can actually act as a prebiotic, but it's good to get a mix, um, which we have in BioBalance in powder form. So it's really easy to give to kids. No need to swallow a capsule.
Mm. Okay, so we have another question. I have a child who doesn't eat much vegetables and fruits. She
Mhm.
only eats rice, soup, broth, egg, tuyo, or bangus, and craves sweets in the form of simple carbs. Carbs. She has chronic nasal congestion. What pre
Okay.
or probiotic would you recommend for her?
Okay. I think I kind of already answered that question
Yes.
earlier, but I would suggest, like, if your child is craving sweets, try and give her fruits instead of other simple carbs. So try and give her mangoes, which are sweet, grapes, papaya. Try and give the fruits, because at least she's still getting some micronutrients. And fruit, and the sugar or fructose from fruits is not the same as sugar or carbs that you're getting from processed foods. So yeah.
Mhm. Okay.
Okay.
So another question. My wife and I are expecting our first child. Does she need to regularly take probiotics? Is this safe for our baby?
Okay. Good question. And the answer is yes. Um, the and that it yun na lang. The answer is yes, because there's so many things that there's so much benefit for taking probiotics, and yes, it's safe for your baby. They Before, we thought na sterile yung loob ng womb ng uterus and the child isn't exposed to the bacteria, but actually they are. So just make sure that you're taking multiple strains, and also making sure you're supporting it with diet. Like, you can't just take probiotics and assume that will improve your neighborhood, but you're still eating a lot of processed foods or nutrient poor foods. So, but yes, and congratulations on your um, pregnancy. But yes, take probiotics.
Okay. So
And last, sorry, I also want to say, she can start taking the probiotics now, and then make sure she continues it once baby is born, because we can actually, the bifidobacteria can actually be passed through breast milk. That's why breast milk is best for babies. So start now, and then just keep taking it until she stops breastfeeding. Okay.
so another question. How do we do the betaine HCl test?
Okay. So there's something called the betaine hydrochloride test, which we use to kind of like as a therapeutic trial to see if you need stomach acid support. You buy a bottle of betaine hydrochloride, and then what you do is, with the protein containing meal, you take one capsule. So kailangan may protein. So if, for example, you had let's say all you had for breakfast was, and this is not a good breakfast. pandesal and kape. Doesn't have a lot of protein, don't take it with that. So it has to have protein. Take 1 capsule of the betaine after you eat that meal with protein. And then just pay attention, do you have any epigastric pain, nangangasim, sinikmura ka ba, did you get reflux? And then if you didn't, for the next 2 meals of your day, take 1 capsule with each meal. And then after, just pay attention. Kung walang issues the following day, take 2 capsules after the protein-containing meal. And then again, you observe. And then the next day, if everything's fine, you take 3 with each protein-containing meal. Tapos kung okay pa rin, you take 4 until you reach 5. Okay, 5 is the max. Or until you start getting symptoms. So for example, you nagpa 5 capsules ka na, biglang sinisikmura ka na, mahapde, nag-reflux, then one, you can treat that with an antacid like, let's say, like for first aid, Kremil S or Gaviscon or baking soda. But go down to 4 capsules, and then you take that with each meal. The In my patients who I use this with, it's usually when they're presenting with bloating, a lot of gassiness. Um, Sometimes some have nausea after eating. Parang mabilis silang mabusog, and then parang nasusuka sila. And this helps them to digest. So once they start taking the betaine, those symptoms improve. So it's one way na you'll know na you needed to support your stomach acid. And then after a while, what this does kasi is it breaks you out of that cycle where you're not making acid, so you're not digesting well, so you can't absorb what you need to make acid, so you're not digesting well, and it keeps going. So it breaks that cycle. I would note though na if you have reactions to 1 or 2 capsules of betaine, stop doing it, because it might be it's not na sobra ka na sa acid. It might be kulang yung mucus layer. And that's when you can take okra or aloe vera and just support that mucus layer first. Caveat on this betaine hydrochloride test: this is dangerous to do in people with ulcers. So you have to do this under physician supervision and make sure na wala kang ulcer, because if may ulcer ka and you do this, then it will aggravate that ulcer. Okay.
Okay. Okay, another question. Is it possible to be allergic to certain probiotics?
Oh, tricky question. I am not 100% sure. I would say it's unlikely to be allergic to the actual probiotic, like to the actual bacteria, but it might be that the other components in the probiotic supplement, like maybe the capsule or some fillers, that might be causes of, might be allergenic. But I am sorry, I cannot answer this with 100% certainty. I would think
Okay.
no, but
Mm.
take it with a grain. I've not had any experience with a patient being allergic to probiotic. Some patients can react. If they take probiotics, they suddenly become gassier, like they have more bloating. In some patients, it can cause diarrhea or constipation, because once that balance of the yung population of bacteria in the gut start changing, then of course the gut function also starts to change. So again, if you're having issues with taking probiotics, you notice that when you take it, parang but hindi siya nakaigi, lalong sumama, then it's best to just get a consult so that we can figure out why you're reacting that way. And maybe there are other things that need to be addressed before you start the probiotics or in addition to the probiotics.
Okay. Another question from one of our viewers. Can one eat too much okra?
Um, dami ng mga tricky questions. I guess yes. Like everything in moderation, right? Anything in excess, no matter how good it is, can be bad. The Yeah, maybe. I
Okay.
don't know. I've Most of the time when I tell my patients to eat okra, the most the common reaction I get is, yuck, I don't like okra kasi slimy siya.
Slimy,
But
yes.
that's the whole point. The slime supports that mucus. So yeah, but well, okay. So, like I said, everything should be in moderation. So yes, maybe you can eat too much okra. These the supplements that help support the mucus lining, sometimes they can prevent absorption of some medicines, or they slow down the absorption. So for example, I learned about okra from a patient who had, I just wanted to share this, from a patient who had diabetes. And she was able to show me, because she was monitoring her sugars, that whenever she had okra water in the morning, her sugars were much better. So I learned that from a patient. That's something else I like about functional medicine. We learn a lot from our patients. It's a two-way interaction.
Okay. So, another question: does posture affect gut health? How?
Yes, super. So for all of you right now, can you just take a deep breath, as deep as you can? And then, because I'm guessing that the majority of you are slouched, I want you to sit up and then take another deep breath and see if that makes a difference. And I can't see people replying, but if you notice the difference, then you know our posture affects the way our organs are positioned inside our body cavity. And if they're cramped, bring you if you have to work in a cramped space, mas mahirap, 'di ba? If they're cramped, the blood flow isn't as good. And then also like I said, the vagus nerve deserves a webinar to itself. But the vagus nerve sends signals from our organs to the brain and then back. And the postures that a lot of us spend our time in, we're crouched, we're looking at our gadgets, we have our head is in a like bent over posture. You know, these postures are actually um when we crouch in fear, diba? These are crouched, that's position that the signal to your brain is that you are in danger. And when you're in danger, it doesn't really care about digesting food, it cares about surviving. And we're not aware of this. It's an automatic nervous system thing going on. So yes, that simple posture, one, by affecting how your gut and organs are positioned. Two, because of the way the vagus nerve in the brain interprets those postures. Does that make sense? I hope that made sense
Mm-hmm,
to
mm-hmm,
whoever asked that question.
mm-hmm. Okay, another question. What will we do if madalas po mag-recur yung acid reflux?
Oh, madami. But the first one is, please, for the person who asked this, observe how you eat. Are you chewing? Are you drinking a lot of water? I've had several patients where they just, learn to chew slower and they don't drink water with meals, and that helps with the acid reflux. Um, Okra again is another good food as medicine approach to that. And then of course there are the other more commonly known, don't lie down immediately after eating, keep your head a bit high. If madalas siya mag-recur, again, it might be a good idea to get a consult so that we can kind of dissect what else is going on, and help you with how to resolve that acid reflux.
Okay. So, one more question. Is cultural enough source of probiotics?
So Culturel is a good probiotic supplement, but it's one strain. It contains Lactobacillus GG, rhamnosus strain. And again, it's good, but we want a variety of strains. So it's good, but you should have others also.
Another one. Can autoimmune disease be healed and
Hmm.
gut problems?
Okay. So autoimmune disease, for the viewers who aren't familiar, it's when your immune system is kind of attacking your own body. And before in med school and while I was in residency, the prevailing thought was, autoimmunity is, we didn't know what the cause was. So your immune system got confused and started um, doing that. But now, in the past, I think mga 10 years, there's the research has come out that a leaky gut is like one of the recipes for you to develop autoimmunity. So I want to go back to that analogy. If your fence, remember that house, that mansion, and the fence, if your fence is so leaky that there's so many things coming in, there's the barrier isn't functioning well. Your immune system, those canine units, are running after everything and anything, and they can get confused between your the invaders and from friend and foe, right? So they have shown, and this has happened in a lot of patients, where you address the leaky gut and maybe some other root causes, but you address the leaky gut and the autoimmune condition improves. I can't really say healed, because and I have a colleague, a doctor colleague, who reversed her SLE. But whenever she falls off the wagon, so for example, her diet starts to become not so good again, or sleep wise, she starts getting sleep deprived, the symptoms will come back. So it's not like I heal it, I heal my gut, I'm healed of the autoimmunity, and then I can just go back to my previous lifestyle, right? It's an ongoing thing. So whenever she keeps to those lifestyle habits that support her health and her gut, she's fine. I think as of now, she's going on 4 years steroid free, and she only gets flares when she falls off that lifestyle wagon that she has built for herself. So yeah, there is hope for autoimmunity. Um, yeah, there. I will stop now because I think there are other questions.
Mm. Second to the last question, any reactions between VCO and probiotics?
Hmm. Not that I'm aware of. And that's about all I can say about that.
Okay. So yeah, another question, follow-up question from Doc Bo. Until when will you take the betaine hydrochloride? When
Okay.
will you need to stop using it?
Okay. Good question. From my experience, the two things happen. One is the patients start getting symptoms. So, for example, they went all the way up to 5, they started feeling better, and then after a while, they'll start getting symptoms with the 5 capsules. Like they'll start getting heartburn or nag-epigastric pain, and then we bring it down to about 4, one step down, and then they're fine. And then after a while, at 4, they start getting the symptoms again. So we bring it down to 3, and then to 2, and so on. So symptom based until pwede nang tanggalin. Now, in other patients, they don't have any symptoms, and it's really a conversation between the patient and the doctor to say, okay, sige, let's try reducing that dose and see. So in other patients, we'll reduce the dose, and then we'll pay attention, does the bloating come back or whatever they were dealing with before. And if hindi mag-come back after another couple of weeks, baba na ulit. And then if the symptoms recur, then we bring it back up to the yung previous na dose. So ano siya, walang set time. It depends on the patient. And also another caveat with that, with using betaine to support your stomach acid, it also depends on how much protein you had. So for example, if you had a big steak, then maybe 3 capsules of the betaine is not enough. But if you had like one nilagang itlog, the 3 capsules of betaine will be too much. So it also depends. Our stomach doesn't produce a constant amount of acid. It responds to how much food and protein we're taking. So again, you can do this with yourself, but it's better if you have the support of a doctor with you. Okay.
Okay. One more question, Doc. What is the number
Okay.
one advice you would give to address chronic constipation?
Hmm. Okay. So there's so many things that can be going on with chronic constipation. Diet wise, are you getting enough fiber in your diet? Are you getting enough water? That's one. Um, gut dysbiosis wise, so it depends on the balance of bacteria in your gut. There are certain bacteria that if they're overgrowing, they can produce a certain type of gas. Na I can't really remember now kung anong klaseng gas. I think methane, but which makes your what do you call this? The intestinal motility makes it slower, so you get constipated. It can also be chronic constipation can be due to a lot of stress. So if you're always in stress mode, that affects the vagus nerve, and the vagus nerve has a role in the motility of the gut. So, parang walang number one advice. My number one advice is to, uh, ha, is to find the root cause. Because I don't know what this. It really depends on what the cause of the constipation is. So look at those first: the fiber, water, um, the probiotics, and then what's the other one I said? Shocks, I forgot na. Sorry. Come na lang and get a consult and then himayin natin together. Kung ano yung roots.
Yes. Okay.
Sorry, okay.
So one more question. What are your thoughts on coffee and how it affects our gut?
Okay. Gosh, coffee. Um, so, okay, coffee can help people, ayan, with constipation. In connection to the previous question, coffee can help with constipation. It can stimulate motility. I guess the one caution with coffee that I would say is look at the quality of your coffee. So you definitely want to stay away from the 3-in-1 coffees because they have a lot of sugar and creamer, and again they're processed. But brewed coffee is much better, especially if you're getting like beans and then you're grinding them yourself so that they're freshly ground. They don't get rancid, or they don't oxidize. So freshly ground beans, brewed coffee, good. And then not a lot of sugar, no milk in there, just like coffee. Um, that will have its benefits. And then of course in moderation. Have like a cup a day. Don't go like 3-4 cups a day because anything in excess will create problems. So again, no black and white answer, but yeah, brewed coffee in moderation can help.
So one last question, Doc. Is there
Okay.
a cleanse you would recommend for a healthier gut?
Huh. Okay. So ideally we cleanse our gut daily. Like you should be moving your bowels and pooping, every day. But if you want to do, let's say, like a 1 week cleanse program, I know there are protocols out there. I have not used them myself. But there are juice fasts. You can actually just do an actual fast. Like don't eat anything for 24-36 hours and just get your gut clean. Just take water. But I can't give you one specific program for bowel cleansing, because I haven't used any like set programs. But ideally, if you're eating enough fiber and drinking water and your gut is, the motility is fine, you should be cleansing your gut every day. Like overnight, what happens in the gut is the small intestines kind of sweep everything to the colon so that in the morning it's ready to be released. So that would be the ideal cleanse daily or sometimes twice a day. But yeah, I'm sorry, I can't recommend the cleanse that's like a program type.
Okay. All right. I think there are no more additional questions. So I'd like to thank Doc Eka for taking time to help us know more about the importance of maintaining a healthy and a well-balanced.
Yay.
Again, these advices are not meant to replace doctor's order or prescription. It's still best to consult with a physician or you can schedule an appointment with one of our wellness MDs. For any follow-up questions that you may have, or for those who want to schedule a one-on-one an online session with Doc Eka or any of our in-house doctors, drop us a line through our FB or IG page, or you may also contact our hotline number 0917-866-2689. Again, that's 0917-866-2689. For those looking for professional grade and premium quality supplements that can be delivered at the safety of your homes, visit our website at www.biobalanceinstitute.com. Use the promo code BALANCEGUT and get exclusive discounts. Remember, you are what you eat, digest, and absorb, so take care of your gut. Thank you again for joining us, and we hope to see you again in our next webinar. Thanks,
Thank
Doc.
you. Bye, everyone. Happy Sunday.